Welcome everyone. Thanks for taking valuable time out of your day to join us to kick off the Angel Flight West retreat. We're going to wait a few minutes for everyone to join and for our other panelists, and then we'll get started. So grab a cup of coffee, get one for me if you have it. I need to stay awake, and we'll get started soon. Thank you. Welcome everybody. I'm seeing some familiar names joining us. Great to see you virtually. I'm bummed we can't be together, but also excited that we've got so much participation and can involve more people this way. Silver linings playbook, right? Hi, Rob. Hi, Lee. Hi, John. Hi, Beth. Martin's teaching us already how to use the chat, so I'll go ahead and do that today. All these buttons right down here, you've got chat, Q&A. You can type in there anytime. We've got our Angel Flight staff available to answer some questions. We'll get to as many as we can today too. We'll also be putting some informational stuff in there for y'all. Someone already asked how many are joining us. I think we had 150 RSVP. It looks like we got about 75 now. Hi, Herman. Thanks for joining us. Hi, Stuart. Miss seeing you too. And yes, Nathan, hope to meet you in person as well. Thanks for joining us. For those of you who are just joining us, we're going to get just started in a minute or two. Waiting for our moderators to get everyone in the room. Got a big crowd today, so lots to get through. Thanks again for taking your time to join us. As we all know, it's the most valuable thing to donate. Stephan, I do see Rich in there if you want to make him a moderator or a panelist. He's in the R's. Hi, Ron. Good to see you. Welcome. Yeah, Lee, the mute is in the lower left-hand corner. If it's crossed out, you should be muted. I think the moderators had everyone muted to start. We may turn some mics on during Q&A when we have the opportunity, but thanks for asking. Stephan, give me a thumbs up if and when Rich is panelist, and we'll get going.
So I set him to panelist, but he should be logging back in again as a panelist.
Oh, okay, gotcha.
He's no longer on the list, so I think he's probably in the process of doing that.
Great. Well, I'll answer some questions since they're already coming in. So someone asked how many people normally come to the Angel Flight Retreat. We typically try to move it around so that we can engage volunteers in different areas. One of the silver linings, I guess, of this situation is that anybody can join at any time. But in a typical meeting, we have, I would say, 30 to 50 attendees. We always try to have the staff there, wing leaders, try to make it a priority to come, board members, and then we invite any volunteer that's willing to come. It's a good opportunity to kind of get into the weeds a little bit. Everyone views, just like anything in life, everyone views an organization through their own lens. And so it's kind of neat to see how all the pieces fit together. We've heard repeatedly, and something we're trying to change, and we'll get into that a little bit too, from our volunteers, that sometimes being a volunteer feels a little insular. You talk to us on the phone, you see the emails, you see texts, you see the patient, you deliver them, but you rarely see other volunteers and know what else is going on behind it other than your own user experience. So the retreat is a good way to kind of peel back the onion, because essentially what we are is a platform, right? We provide people and technology to do the vetting and arranging of the flights and recruitment of volunteers, et cetera. But at our core, we're matching a volunteer with someone in need and just pairing them up day over day. So that's really what it's about. But the reason we do this every year is for that reason, to have a touch point, make sure that we're returning and being focused on our mission, and using that as an opportunity to engage volunteers and learn from them and let them lead, because we've always been a volunteer-driven organization and want to continue that as we continue to grow. Hunter, great question. We've got slotted 4 to 5:30. It really depends on questions and answers. My section won't be that long. And then once we get going, I'm sure we'll have more questions, but we'll cut it off before 5:30. And we know people have schedules, so feel free to leave whenever needed.
Josh, I don't see Rich, so maybe you should just go ahead.
All right, we will go ahead and get started. Make sure I don't have anything. Oh, he's texting me. No, he's going to dial in. So when Rich Connie arrives, I'll have him say something. So first of all, let me just welcome everyone officially to the 2021 Angel Flight West Retreat. 2020 was quite an interesting year, and we'll talk more about that. But more than anything, just personally, I feel really inspired by Angel Flight, our patients, our volunteers, that we were able to serve through the pandemic and be part of that solution. And we're excited and see the light at the end of the tunnel with many of our volunteers getting vaccinated, many of our healthcare partners scheduling more non-elective surgeries and appointments that many of which suspended during the different spikes and so forth. So we want to thank you, and we are here for our volunteers and to better serve our patients. And that's what I want to start this with. I've got a little video that I want to start us out with. We always want to return, as I mentioned earlier, to what we're all about, and that's our mission and serving other passengers. So I'm going to go ahead and start this presentation.
Ground Angels working.
Let them say it for us.
Thank you. Yeah, thank you. Good job.
Thank you, Angel Flight. Thank you, volunteers, Ground Angels organization, administration, all of that. I just thank you, and you deserve praise for what you do.
I just want to say thank you, and I still remember the number of the plane, 019er.
Angel Flight West has meant the world to me. They got me there and back, even though my pilot wasn't available that day. A round-trip ticket was bought for me so that I could make it.
I was in a situation where I really wasn't sure how I was going to get where I needed to go, and All of you made it such a wonderful experience. I have honestly felt so loved and cared for and safe every time I had the experience with Angel Flight.
It's been a huge part of our story to have Angel Flight there to support us. And we really appreciate all the donors and sponsors and pilots and the team and all the work that you do for all the families. So thank you.
My experience with you has been so amazing. You all have been so nice, caring, loving, and supportive. I want to thank each and every one of you for all that you do for me and for others.
And I appreciate this greatly. It helped me get to my surgery and post-surgery return home. And I am grateful.
I just want to say thank you so much for all the donation that you guys have provided.
Would like to express our thanks to everything you've done in being able to get boxes down to the Hopi and Navajo people.
Thank you for making my donor's flight so easy.
I want to say how much I appreciate the Angel Flights giving me flights from here to Denver and Fort Collins when I was doing chemo.
I always said I just look for the nicest person in the airport, and I know it's our pilot.
So thank you and heads off to all the Angel Flights team.
And I am forever grateful for the benefaction of Angel Flights West, but I owe a huge debt of gratitude to Angel Flights West and the pilots.
And this is my opportunity to express my appreciation to the Angel Flight people and the ground angels and the people in Santa Monica, because what you have done is to save my life.
So that's why we're here, and a great reminder from many passengers that we know well, and a great reminder of how much I miss seeing our passengers and pilots. So again, thank you for being here virtually, and would encourage you to look over the agenda for the rest of the week and meet more of our volunteers, our staff, our passengers. We really want to hear from you and are excited to learn from you and excited to share some of our plans too and get feedback and opportunities to help advance that, because we all love Angel Flight. We all love that experience, and that's why we volunteer for it, we work for it, whatever the case might be. It does truly take a village to do what we're doing, and we've got a really great village. And that's why the need is there, the need to serve people that need access to healthcare. You can see here just the few highlights, and I'm going to keep this pretty high level in terms of what we're going to cover today. We'll get into the weeds, like I said, on those different seminars throughout the rest of the week. This is really just to kind of kick us off and show where we are, where we're going, and where we've been. And that will give us a good kind of 360 helicopter view of the organization itself and where we all fit and how we can, as a village, do this with more efficacy, more efficiency, and be able to scale to serve more people. Yes, so back to the need. Transportation is the biggest barrier to healthcare after cost. There's 3.6 million Americans, roughly the size of Chicago, who are not receiving healthcare because they simply can't access it. Many of our hospital partners like to say even the best physician in the world can't heal someone that they can't see. And currently, with our partners, we believe we're serving a little bit less than 5% of the total need of people that need access to healthcare that we would be able to serve, meaning people traveling more than 50 miles, are medically stable and ambulatory, doing some sort of outpatient type treatment, have a financial need, et cetera, that are able to travel. And so really, we just want to grow into that need. We know that those people are out there, and we feel like it's our responsibility to be able to serve them well so that they can have the best hope for health and success for them and their families. The need for the annual retreat, we talked about this a little bit as we joined. This is a strategic planning conference by nature. We get into the data and the details and the resources that we have. But we also really want to build that community and culture. I started this off by saying The volunteers and the patients are my heroes. I love meeting them. I love hearing their stories. Inspires me to do, a better job as a representative of this organization. And we also want to hear from those volunteers. We want you to take ownership. We were started by volunteers. We want to remain volunteer driven. We want to be a platform that enables that kind of matching. And so that's really what this annual retreat is for. And I'm going to just pause there real quick and stop the screen share and see if I can have a few words from our board chair, Rich. Stefan, if you can unmute, I think Rich is the 510 number up there, right?
Yeah, he should be able to unmute himself now.
All right, Rich, if you're there, we'd love to hear from our fearless leader and longtime Angel Flight volunteer. If you're able to unmute, I know you wanted to say a few words to kick us off.
Then we may need to come back to him.
Yeah, okay. Well, we'll continue on. I just saw some of the Q&A, and one is relevant here that I should say now. For those of you that do need to pop in and out and are going to miss some, there's a question from Alexi asking if these sessions will be recorded. Yes, these will all be recorded and made available to our volunteers and the public afterwards for review. So please feel free to use those. We also intend to use these too and continue to do these recordings ongoing because it is a good knowledge source for all of us to continue as we go about our daily volunteering and work. So I'll go ahead and get back into the presentation real quick. So this is, my kids are in virtual learning. So this is a little bit of like an Angel Flight West history lesson. We already talked about why we're here, and but I want to talk a little bit about where we've been. So this is an opportunity to refresh, and I'll just start with the basics because we saw that video from our patients. We talked about the need for the retreat, but our mission for Angel Flight West, for those of you who've not read this, is to deliver health and hope using donated flights to serve those with compelling needs or healthcare needs. Angel Flight West accomplishes this by linking volunteer pilots, commercial airlines, and volunteer drivers with people whose non-emergency health needs require air transportation to access care. That is a mouthful, but really what we're doing is delivering health and hope using donated flights. Our driving focus is centered on serving one passenger at a time, one flight at a time. We'll talk a lot about the numbers, but those passengers that we opened up with, and as Lee Gerstein just said, normally doesn't touch me hearing testimonials, but that one really got to me. Well, our passengers really get to us too. And we want to focus on them because each one of them is a story. They're a mom, a dad, a child, a brother, a sister, and their world has been turned upside down. So we want to meet them where they're at. And there's a lot of them. So we exist to meet the need for access to healthcare and hope for patients. And we want to serve more of them. So we desire to increase our service and to serve our patients well. And by doing that, we as an organization need to serve our volunteers, our pilots and drivers, our partners, and our patrons well. We would love to not ever be needed, right? If everybody had access to healthcare, we'd love to go away and find a different way to use our airplanes and our cars and our time. But as we started this meeting, it's a huge need. And our vision is to totally eliminate that barrier to transportation. And in terms of our value, we value a culture that is board-led, staff-managed, and volunteer-driven. We foster a culture of safety and professionalism focused on care and service to our passengers, operating honestly, transparently, and always seeking to improve. So That's our culture, that's our heart. And we kind of talk in 4 key audiences: our passengers, our pilots and drivers, our providers and partners, and our patrons. And for those of you that don't know, Angel Flight was founded in 1983. Dennis Torres and his wife Avery and about 9 other folks got together and said, hey, I think that there's a better way we can use our airplanes than flying to Catalina for bison burgers. And they approached some local hospitals and sure enough found out that there was a need, not necessarily what they thought originally, which would be transplants and those types of things, but people that had to travel to healthcare that couldn't get there. And so that first year they flew 15 flights. 4 years later, they'd flown 170. And then they realized this thing was growing and the need was much bigger than they could accomplish. So they decided to hire their first full-time employee in 1988 and started to fill out that staff more in the mid-90s. And then in 1997, bridged out from California, where they started, shared that model actually across the country, which is why you see all the different Angel flights with the different monikers, because pre-online internet and so forth, that made more sense. And the range of most general aviation aircraft made more sense. And so we started to share that model, and then it started to expand it into the 13 states that we currently serve. And that's when it moved past 3,000 flights. And then in 1999, one of our volunteer pilots, one of those early Microsoft volunteers, said, hey, I think I can help you guys expand this, and went into his basement and came out the next weekend, and it developed what we called at the time aphids, which is now called VPOIDs. And that really helped us to expand even greater because the tool to arrange travel became web-based and easier for everyone to plug into and find those opportunities to volunteer. In 2003, another group merged with us, and that's where the relationship with Alaska Airlines started. As many of you know, Alaska Airlines donates over $500,000 worth of tickets each year to help people in need of transportation for healthcare, 70% of which are in the state of Alaska, but the other 30% here in the lower 48. In 2007, we had a big milestone of 50,000 total flights flown. 2012, we were able to launch the next iteration of our software, which then also became an app. And we crossed, the 4,000 flight per year barrier. And then in 2014 and 2017, the organization made some strategic investments to try to grow. So when we launched Ascent to 8,000, and we're able to move the needles up and to the right. And then in 2019 and 2020, we eclipsed that 5,000 a year flight mark in 2019, and then this year crossed 84,000 total flights. So that's kind of just a real brief history. Again, if people have questions, happy to get into those more later. Here it is kind of represented visually in terms of flights per year. As I mentioned earlier, this Ascent to 8,000, which we'll get into a little bit more in terms of the details, but what that really was a strategic investment of time and resources to say, hey, as you can see from 2004 to 2014, basically a 10-year stretch there where we were plus or minus 10% of 4,000 flights. And so we had to, as an organization, make the decision, is that just, our ceiling? Or, what is the total need out there? Because up until that point, we just kind of reacted to, the phone that rang and the emails that came in. We of course did a lot of outreach, but we didn't really have a full grasp on the total need. So we went out to some of our healthcare partners and did some research and looked into this and, unlocked all the data that we started this with in terms of how huge that need is. And that's when we determined, okay, we're just sort of scratching the surface in terms of this total need. So if we really want to grow to meet more of this need, if that's what our mission is in our organization, we need to change a few things and get a little bit smarter about how we're reaching these folks who need us. And so that's what happened, and that's where you can see that growth. Obviously, this year threw a little bit of wrench into the works. Here's the details that we just talked about. Bill Ayer, who's the retired CEO of Alaska Airlines, a mentor of mine, a longtime volunteer pilot for Angel Flight, is the one to kind of help us with this challenge grant to make this possible. And what we did is we borrowed kind of the Amazon methodology for management, which is a sprint or agile management. And we created these, distinct little projects that we thought could move each of our key data and metrics forward. And really our key data and metrics are what we said: missions arranged, missions flown, missions canceled, volunteers acquired and utilized. And then same thing for patient outreach and utilization, new requesters, which are our healthcare facility or patient groups for us. And then we have different initiatives under each of those metrics that we try to move the needle. So what we were able to do is do a lot of those over the last 5 years, and be able to sustain and tweak the ones that were working and throw out the ones that weren't working, so we could learn, and then obviously shared all that with our partners from the different Angel Flight and other volunteer flying organizations. So the big, hairy, audacious goal, and why it's called Ascent to 8,000, was that 4,000 number I mentioned earlier. We wanted to double that. What would it look like to serve 10% of that need? And so that's what we've done, and we're really excited that we've that those initiatives and with our volunteer help has resulted in 44% growth thus far. Here's how we mapped it out originally. As obviously 2020, we'll see, had dipped down a little bit and threw a wrench in our plans, just like it threw in the rest of the world. But again, really proud of us for being able to pivot and continue to serve that need and be positioned to continue to what we anticipate be an increased need as we come out of the pandemic. There's still a lot more to go. We had to tweak this plan too. Initially, it was much more aggressive and exponential in growth, but then we realized we'd run out of money pretty quickly if we did it that way and burn out a lot of staff and volunteers. And so our plan is to grow linearly and sustainably over time. So history lessons over. We'll do current events lesson now for those of you like me that have to be a tutor for homeschool. This feels much like an extension of some of my kids' classes, but such is the pandemic. So here's to this year's numbers. I stripped this down and just to kind of give you an overview of what our situation is looking like currently. In 2020, here is our actual numbers. Oops, let's go back. We scheduled roughly 6,000 flights, of which we flew 3,500. For those of you who don't know, we do cancel a lot of flights each year that don't get flown. That number looks pretty drastic, but 80% of those flights or more are typically from our passengers, that their schedules change, they become too sick to fly, their white blood cell count isn't where it needs to be, etc. So actually, typically, that's a 66% number. We fly 66% of the missions that we actually scheduled historically. Obviously, we're trying to get more efficient in that and drive that down, but that's why the disparity is so great there. Of those 2,500 were pilot flown missions. Commercial missions, you can see, weren't down as much if you look over here at the year-over-year change. That's for a couple reasons. One is obviously commercial airlines continue to operate there, but we also got a lot more resources from commercial airlines. Alaska Airlines donated a lot of flights for healthcare providers that were relocating to help with front lines. Southwest Airlines donated a few of those too. So we were able to use those for other things. We were able to deliver testing kits through Alaska Airlines Cargo and a whole host of other things. So that's where some of those numbers aren't as low as the others. But as you can see overall, about 30% down year over year. And the majority of that was actually a blessing in disguise, because as you'll see later, our volunteer capacity was about the same. And the healthcare providers, that was pretty true for them too in terms of treatment. So obviously pandemic was wildly disruptive. Healthcare was right at the top of the list of that disruption. Obviously they were the front lines and had to not only treat the patients affected by COVID, but also to triage their existing patients and keep everyone safe. So we pivoted off these original goals pretty quickly in March and said, hey, we're throwing these out the window, but we're here to serve, and we want to do that, keeping everyone safe and as responsibly as we can. I'll pause here too, just real quick to to recognize the disruption that caused among our volunteers, our staff, our family. Obviously, our volunteers are all working remotely. You'll see them here in a little bit from their homes. I'm in the office. Currently, I split about half time in office and out from home. Our office actually flooded during 2020 to add a list of crazy things that happened. So we're in the process of getting that rebuilt. And the beauty of Angel Flight, though, is that we can be remote, that we can be virtual, and our volunteers are literally everywhere. And so we thank you for your patience and your willingness to volunteer. I want to thank everyone who made the difficult decision that wanted to fly passenger flights that opted not to for their own safety or the safety of a family member or the concern for the safety of the patients. Thank you for making the decision that was right for you and your family. For the volunteers that chose to use our risk mitigation process and procedures, and knowing that the patients knew that too, to continue to volunteer, thank you. You heard that video at the beginning, was really moving to our patients, moving to us personally. It's been very disruptive. Obviously, we had some of our staff be hospitalized and intubated, and that was a really scary time for us as well. And just feel very fortunate that we have the level and passion of knowledgeable and passionate volunteers to help guide us through that, and a staff that was really roll up their sleeves along with our volunteers and be there for the people who needed us. And we've got some really great stories to share with you throughout the week of what that looked like. We currently have a pilot too that's hospitalized. It's based here in Santa Monica. So we know a lot of other volunteers that have gotten COVID from different things. There hasn't been any transmission on Angel Flight, to be clear. And we're pleased that risk mitigation processes seem to be working well. But as we all know, there's no way to mitigate that risk to zero. And so we just offer our thoughts and prayers to everyone who's been affected. And it's obviously not just the healthcare part of it that's affected. People's jobs and livelihoods and everything else has been turned upside down. So just wanted to pause there just to say that, and to make sure that we're here with you and feel honored to serve alongside you as part of the solution. And we look forward to, as you'll see here soon, look forward to our plans to resume and be part of that solution even further. I'll just pause here real quick and look through questions. I got Lee's there. Neville, on flights canceled goal, what is it and how much does it impact operation? So Neville's asking a little bit more about why those cancellation numbers were so high earlier. So we actually break cancellation numbers down, and perhaps the mission ops team can share that in one of their presentations coming up. As I mentioned, the huge chunk of that is patient cancellations. And that's simply either the doctor has changed their clinical day or appointment, or the patients had to reschedule themselves because they're sick, et cetera. We do about 8 to 9% where we just physically can't find a volunteer that can fly the flight on that day. Another 7 or 8% is weather related, so we're not going to compromise safety. So we're working with those patients to get them otherwise or to reschedule. We'll talk. I'll get into it a little bit more. We've got some funds set aside now to drive that number down even more. But in terms of being more efficient, which is what you answered, Neville, is a lot of these different initiatives and a lot of actually the tactical strategies of the coordination team is to make sure that both communication and our routing and volunteer utilization is effective enough that we can drive that number down as much as possible and effectively use our resources as much as possible. Obviously, our biggest resource are the donated flights. So I probably won't get much more into that now, but I would encourage you to tune in or to watch the mission operations team, because they'll go on a deeper dive into what that looks like on a day-to-day basis and what we're doing to try to drive that number down. All right. So back into where we are and where we're going. So just the effects of the pandemic, since I talked about it just now. So the request for flights, you just saw the numbers, down 35% in 2020. We were really thankful for Dr. Hunter Hansfield and Rich Pickett, who was the staff member I mentioned earlier, and our safety officer, who believes caught a COVID flight after ferrying an airplane and flying back commercially in February. They led that charge along with our board members and staff and some other highly committed volunteers and wing safety officer to figure out how to best mitigate risks inside of our aircraft, and how, as we as an organization, educate our patients and our social workers and requesters about that and implement safety protocol. And thank you all for volunteers for being so flexible and willing to mitigate that risk as much as possible. Just full disclosure, we have had a couple that we flew to, patients that we flew to treatment, and in the workup they always do COVID testing, and a couple of them did receive positive tests. So we have a process for that in our safety to go through contact tracing and notify all the volunteers involved. Again, very thankful that nothing was passed, in flight or at any stage of that transportation. But that's the world we live in, and the one we continue to navigate, and we'll continue to do everything we can to keep people as safe as possible. So our volunteers I mentioned earlier, thank you for each of you for making the right decision for you and your families. Currently, we're about 60% of our volunteers, although that's growing with vaccinations, and we'll get into that a little bit, that are available for those passenger flown flights. And thank you to those who didn't want to fly passenger flown flights, but had some supply flights in your area, for rolling up your sleeves and really tackling that in impressive fashion. Same thing, the pandemic upset everything. We lost our major fundraiser for the year. The economy was obviously wildly volatile. A lot of people's companies and corporate giving had to scale back. So as a result, our operating revenue charitable contributions decreased 24%. But fortunately, through some stuff I'll talk about later, including our reserve fund and PPP, we haven't had to make any cuts, and we're positioned well to grow out of this long term. Some of the positives about pandemic. Well, I'm going to stop this share. We just decided to freeze up all of a sudden. Positive of the pandemic is that we learned a lot. We were able to pivot off of many of these initiatives that we had. There we go. We started in Colorado delivering personal protective equipment out to rural hospitals around the county. We had a lot of those requests elsewhere too, through our partners at Project Cure, that are another nonprofit that we're sourcing and creating PPE and getting them to vulnerable communities in need. We relocated a lot of pandemic personnel, as I mentioned earlier, for those traveling to the front lines to treat those affected by COVID. And we delivered a lot of supplies to underserved communities, the biggest of which was the Navajo Nation and surrounding Native American tribes and nations. We were able to deliver a lot of supplies to them with groups like With Love from Strangers, Colorado Hospital Association, I mentioned in that partnership earlier, and then Direct Relief. Many of you flew some of those masks up to the firefighters in Northern California and Oregon so that they could keep fighting those and keep folks safe that way. Just a brief update on volunteer vaccinations, because I anticipate we'll have a lot of questions about those. We do find that in most states, our volunteers are eligible in phase 1 or 1B, C, D, depending on the state. The state and local authorities have been very hard to work with, which I'm sure is not surprising to many of you, judging by the news. We are very fortunate on our board as the CMO of Seattle Children's Hospital, Dr. Ojiman, and he's reached out to his CMO network and opened a lot of doors for us. So our Washington volunteers that have wanted to be vaccinated are all vaccinated. Colorado is happening this week. And we're actively working on other wings. UCLA here in Southern California looks like they may be able to have something for us together. Fortunately for us, a lot of these major medical facilities that we already partner with and know that we're an integral part of the patient delivery process, are prioritizing their patient safety, and our volunteers as being part of that are prioritized as well. So we will continue to work on this and notify you when those opportunities become available. This is all relationship based, as I thanked Dr. Ogeman earlier and Dr. Hansfield. If you know of folks in your local communities or local hospitals that are in a leadership role, or can get us to someone in a leadership role, we're happy to talk with them and lead that process to get our volunteers vaccinated. It is a high priority for us, obviously on the safety scale. That mitigation is among the best that we have. And so we would love for that opportunity for all of our volunteers as soon as possible. With that said, I'm hearing every day from other volunteers that they've taken their Angel Flight badge or paperwork, or if you want something on a letterhead, we're happy to do that for you too. Take it to the local vaccination place where there's some guidance in your local community that says, healthcare volunteers are elevated in that phase 1. We're hearing more and more of those folks happening. Actually, that happens a lot in Oregon currently. And I know a lot of other folks that are just of the age group that in their community, that's being an opportunity for them too. So we would encourage everyone to take care of that opportunity. I know that it will help us as we reemerge and as we start to get more requests, as the healthcare communities are better vaccinated, et cetera, to get back to providing that health and hope for a lot of people who've had to suspend treatment and delay treatment, forego treatment in some cases. There's a lot of collateral damage here. So we really just want to make sure we're positioned, and vaccination is a huge part of that. So other important changes made in 2020, just above and beyond the pandemic. So if you've been to our annual retreats in the past few years, we want to continue to further and further ensure safety of our volunteers and our patients. We're really pleased Rich Pickett was hired as Angel Flight Safety Officer last year, and we had a really impeccable safety record this year. So we're really proud of that, and want to thank all of our volunteers for making responsible and safe decisions as it regards to their flying or driving. Same goes to our 8 volunteer wing safety officers that stepped up and helped in that role to foster that culture of self-reporting, safety promotion, and learning. We fly Part 91. We don't have operational control, obviously. That goes to our command pilots, but we're really proud of that our safety record, and want to just continue to find opportunities to be more safe at every turn. One of those opportunities was removing nighttime VFR flights by pilots that aren't IFR current. So thank you everyone for adapting to that change as well. Some pretty clear data on there. And AOPISI has a ton of it if you're interested on the risks involved there. Again, a huge thanks and shout out to Dr. Hansfield and Rich Pickett for our COVID risk mitigation protocol that we were able to put into place. And we also added background screenings for new volunteers. Came up through a couple of specific instances that fortunately didn't result in anything negative, but just wanted to make sure we're doing our due diligence. And again, making sure our passengers are as safe as possible, and our volunteers are committed to that level of safety. And then I mentioned earlier this pivot to meet needs. That was another big learning for us in 2020 is we are a platform. We have a lot of volunteers in different places, and there's a lot of needs for transportation. Yes, healthcare is a huge one of those, but all the other things that we talked about in terms of supply and needs, and we're still positioned well to move people, vaccinators or vaccines when and if needed. That is still very much on our radar with some of our partners. I mentioned Direct Relief as one of them. Team Rubicon is another one. So we're excited and we're ready to jump in where and when needed. And that was a big lesson for us is let's lean into these nonprofit partners like Project Cure, like Colorado Hospital Association, like With Love from Strangers that have very specific needs, and that we can enhance those and use our volunteers, their aircraft, and their cars to maximum impact. Couple other changes, and there's a whole other lunch and learn on this one. Our waiver of liability. I'll just take a brief moment to kind of talk about a little bit why we decided to do what we did with waiver of liability. You got the emails, obviously. So historically, the liability has been plain side, and the justification for that was obviously the pilot is our last point of contact with that passenger, and the pilot or driver getting those signatures and names of everyone that's traveling on that aircraft is the best thing to protect that particular pilot, their family, and Angel Flight West as an organization from any liability concerns. And we had done that for a while, and we had started to more closely enforce that in recent years, and found that we had actually a terrific compliance with that. It was about 92%, but that still left 8% of ambiguity there. Additionally, during that time, we were fighting with Air Care Alliance and the FAA at the time when they were doing their Reauthorization Act in 2018 to protect our volunteer pilots with some legislation. And we're really pleased that that happened. That was a big win for public benefit flying and for Angel Flight West. And so now in the FAA, the most recent FAA reauthorization, volunteer pilots flying charitably are protected from liability at the federal level. So we were really pleased with that. And we realized that that shifted a little bit of the onus off of the pilot if there were to be a lawsuit or something like that from an incident on a mission to the organization itself. And so we were advised by our legal team on our board of directors that we might want to revisit both the waiver of liability itself and the language involved to make sure that we're adequately protecting our volunteers and the organization, but also in the process and protocol. So what we decided is we want to move that compliance as much to 100% as possible. And the best way for us to control that, instead of passing that off to the pilots, which by the way is also another safety concern that was raised to us by some other pilots last meeting. Thank you for that. It was a real concern. And so now, as part of our mission protocol, we receive a signed waiver of liability from the patient and every companion that's flying with them or they anticipate might fly with them. And then provide a copy of that for the pilot. And still the pilot or driver can get that signed plain sight if they want it for their own reassurance, but we also make it available online. So that was a big change. It seems like a small change when you talk about it, but when you try to implement it as a staff and in a technology that have been doing this for 30 years, there's a lot of ripple effects. So thanks again for your patience and for your understanding on that, and for the volunteers that had suggested that we move in this direction for a long time. Thank you for your persistence in that. We're pleased with the outcome. Obviously, always wrinkles to get ironed out there, but we're excited in the direction that's going, and you know, our lawyers feel really strongly that provides the best protection for everybody all the way around. Not my favorite subject, but in today's day and age, we got to do it, right? Pilot affirmation. As part of that waiver of liability, we would affirm before flights. So again, that was our kind of checkpoint to make sure our pilots were operating within the guidelines that they committed to when they joined Angel Flight and became a command pilot or a command driver. So we're still affirming before every flight, but there are flights where people change last minute or sign texts and so forth. So we also are asking everyone to affirm annually. For you old timers and veteran Angel Flight volunteers, that's nothing new. We used to do annual membership and fees and all sorts of things. We don't do that anymore, but this is another check-in that we want you to update your information, your preferences, and to affirm you know, that you're going to meet those qualifications each year. I'll just stop here because everyone always asks this question. Well, I don't meet the qualifications, so I don't want to sign the affirmation. The affirmation is just saying that you are not going to conduct a flight or a drive unless you meet those qualifications. So signing it and never doing it obviously isn't a conflict there. So the other thing that has helped our coordination team and organization, it culled our volunteer roster quite a bit. We've been very successful in finding new volunteers. So thank you all of you who are preaching the Angel Flight gospel to your friends and flying communities and service groups and everything else. We're really pleased at the growth in volunteers and the new command pilots and drivers that we have. But it's also helped us to kind of focus on those folks that are in the pipeline and more active. So just kind of a little side benefit. The other piece that we tried that we had the opportunity to do in January, February, and March last year is to expand what used to be called our Patient Assistance Fund. We've been calling it No Patient Left Behind. Those cancellations that we mentioned and flights that are in difficult weather or over difficult geography, we've made more funds available for commercial flights, for hotel stays, for ground transportation like Ubers or Lyfts, et cetera, to make sure that we're getting those patients there instead of canceling. We experienced great success with that in the first 3 months of last year. So that was a really good beta test. We paused that during COVID for a lot of reasons. But we are excited that we're resuming that now, and there'll be more in that, again, in the coordination and when I talk about our plans for the future here. The other good news is, despite the decrease in revenue, we were able to shore some of that up with the payroll protection plan that we were benefited from and have received forgiveness because we were able to keep our staff employed and working, again, to be part of this solution. We've been very fortunate through some generous plan gifts, stock donations, other things to grow our reserve fund, and the market has helped that as well. So we were able to not have a short-term focus, but be able to continue our long-term goals through that. So we're excited that continues. And, we continue to be, among the most efficient nonprofits out there. We've got an $8 donated in kind to $1 operating cash ratio because of all of our generous volunteers. So it's definitely a multiplier effect, and why we receive 4-star Charity Navigator rating. And I've got some more good news too, and why folks select us and see us as a really viable option for this transportation to healthcare, which is, again, huge need. So real quick, again, normally we would be able to meet each other and eat some cookies and have some rubber chicken and all those good things, but we can't. So I just really, for those of you who don't know kind of how we're organized, obviously we're patient first, and our volunteers are our first point of contact with that. And then we're sort of an upside down organizational chart. So if you turn this upside down and add volunteers and patients, that's what we're all about. But our staff themselves, obviously we're a nonprofit. We're governed by a board of directors who makes fiduciary and policy and strategy decisions for us. They're my boss. They make sure that I'm doing my job effectively and managing the goals and the mission of the operation of the organization effectively. My direct reports are, we have a director of mission operations, a director of development, a director of outreach, which is a new position that was added. So is the director of development for that matter. A CFO who's actually contracted as part of an organization that we get some of his time, and almost full-time bookkeeper that does payroll, accounts payable, receivable, et cetera. We have a chief technology officer. Obviously what we do depends heavily on our technology, both the website and app. And then he works with developers. And then, as I mentioned earlier, Rich Pickett's our safety officer we added last year, and works with wing safety officers to carry out our safety program across our wings. So what that looks like in terms of names, there's our team. Sherry's our director of mission ops. Mary's our development director. Ivan's director of outreach. Rafe Perry is our CFO. Stefan is our CTO. Rich is our safety officers. We have an awesome coordination team. These are the folks you guys probably talking to the phone most often. Alejandro, Ann, Isabel, and John. Our development team with Mary is Kathleen and her team of part-time grant writers that includes Adrian and Kim. Carolyn and Henny are development associates. You wing leaders know Ivan all too well and are probably glad to work with him and not me anymore. That our wing leadership team. So again, we'll have more on that later. For any volunteers interested, we'd encourage you to volunteer there. They carry out our boots on the ground outreach in local areas, both to hospital and healthcare partnerships, but also to potential volunteer pilots and existing volunteer pilots. Daphne is our bookkeeper. She reports to Rafe. And yeah, that's our organization and our team. And this is what they look like, in case you're wondering. We're really blessed to have a really diverse staff and varied experience and life backgrounds. Makes our team really rich in both culture and experience. And we have a really great team. I'm really proud of them for everything they've done. And again, it's a humbling experience to lead a group like this and lead a group of volunteers as amazing as Angel Flight has. All right, well, I'm going to get into where we're going here, but I'm just going to stop real quick and see if we have any more questions that I can answer. Ray Sanchez Pescador, are patients required to test negative for COVID-19 prior to each flight? Through the workup of the healthcare facility, they're vetting those. In some cases, they're not able to test because they don't have access to it. Most of them are, but there are occasions when pre-appointment flight, they may not be tested, but they always get tested there. Stephen, welcome. Great question. Stephen's asking about donor transplant flights. And have they always been a part of the organization? Yes, actually in the early days, the original founders thought we'd be doing mostly transplant, harvesting organs and so forth. We still do those on occasion, although they're rare. The more common is what you're talking about, is flying a donor back and forth, Stephen. We do that quite a bit. And then we fly a lot of pre and post transplant appointments. When we get a transplant request, we have to be really clear on the window of time, and often like cardiac and things like that, it's a very short window that the patient has to get to the hospital by. And because we're not going to compromise safety and that kind of thing, and if it's in the middle of the night and icing conditions and et cetera, we're not going to overpromise and underdeliver on something that important. But if there is a longer window, we occasionally will entertain those. And so that's probably those flights that you're seeing on the missions available board is something related to one of those. We got this question a lot in Washington too. Angel flight vaccination, including spouses. That's going to vary healthcare facility by healthcare facility. So we'll include that in the communication if spouses can be included. We would love that to be the case. It's really a question of supply and kind of regulations that we're receiving from those healthcare facilities. So in the case of Washington, for example, they didn't extend it to spouses unless that spouse was actively flying or driving missions. So if that's the case, let us know and we'll see what we can do to make sure that, again, everyone in that patient delivery is safe. Hey, Kurt. Kurt's asking if there's opportunities to fly vaccination teams to rural areas and non-passenger flights carrying PPE in NorCal. So Kurt is a longtime NorCal volunteer. So the short answer is maybe, Kurt. This has been something Ivan and his team and the wing leadership team has been working on very hard. Myself too, Air Care Alliance. We want those opportunities. And it's a little bit of a waiting game. So sometimes they do pop up and materialize, like with some of these other nonprofit partners I talked about. Sometimes they don't. Specifically vaccination. Last week was the first I heard actually from FEMA and Team Rubicon that there may be some plans to move Rubicon personnel that are going to be vaccination teams to these rural areas. It's not happening yet. So we just simply made ourselves available to them to partner in that situation. And then the same thing for PPE. That has been more of a grassroots effort with other teams. The Project Cure that I mentioned earlier that we've been partnering with doesn't have a big imprint in Northern California, so there hasn't been many of them. Direct Relief does have a little bit more outreach within California, and California DART and us have been doing some of those type flights. So again, we'll keep everyone posted. I will say, again, our volunteers are our strength. So Kurt, if you know of anyone or a different nonprofit that might be in that space up there that we could help with and activate, our volunteer network to help them carry out those needs, we'd love to hear it. So encourage you to let us know, and anyone else to talk a little bit more about that. Ray's asking about LifeStream, which is a blood center in Southern California. So good question, Ray. So the blood centers have been disrupted too. Actually, all nonprofits have been disrupted. A lot of my counterparts that are executive directors with other nonprofits, many of which had to close their doors for a variety of reasons because of COVID, lack of funding, disruption to their service teams. And blood centers are the same. They're nonprofits. So we get this question quite a bit about our blood centers. And I'm going to continue to our last one so we can get through where we're going and answer the rest of these questions. So I'll pause here and then answer the rest of these questions afterwards. But blood centers are nonprofits. They're often large and they do receive payment for the blood, but they have a whole host of other expenses they have to fundraise for. Plus the efficacy of blood from when it's harvested from a donor to when it's going to be processed within a blood bank, there's a relative short amount of time that the white blood cells, the platelets, and the plasma are viable. The red blood cells kind of stay viable for a long time, but those early ones are the ones that are important. And that's why it makes a lot of sense with LifeStream that are doing these blood drives that we can get it to their blood processing center quickly. We will partner with them. Our biggest partner is Bloodworks Northwest up in the Pacific Northwest. We do a lot of flights with them. They've had to pause stuff too because of safety concerns for their blood drives, et cetera. So we haven't been flying those, but we look to resume those as soon as possible. And we would welcome those opportunities in other regions too. It's different state by state. Arizona has a whole different group that flies blood there. But if you know of, again, in your community, if you know of a blood center that's doing blood drives and we could help them with that delivery process, please let us know. All right, I'm just gonna pause questions there. Great questions. I love our volunteers. We probably could have just done this whole thing as a Q&A, but I'll keep going to share my screen and talk about where we are going now. So we've got really great news where we are going. We received news in late December. The Angel Flight West was receiving a $1 million grant and 2-year partnership with the Conrad and Hilton Foundation. For those of you who know or knew Baron Hilton, he passed away in 2019. He was an avid aviator, had some aviation businesses. I had the opportunity to meet him briefly a few years ago as part of his planned giving for the Hilton Foundation. He gave 98% of his estate to the foundation, but he had some turns, and one of those is one of their funding priorities he wanted to add was aviation nonprofits. And so what happened was the Conrad and Hilton Foundation took that very seriously and spent several months researching different aviation groups and who could use this kind of funds to advance a need the greatest. And they found us and chose us after a few discussions and grant requests and so forth that we sent to them, sharing that Ascent to 8,000 plan that we had and wanted to help us accelerate it through a really difficult time here during the pandemic. So we're super pleased and thankful to the Hilton Foundation for entrusting in that. That selection really is more of a reflection on our volunteers than anything else. They saw an organization that had really committed and passionate people that were willing to donate a lot of valuable time and resources to get people the health and hope they needed. And they recognized that, and they saw our track record of success and being able to grow into that need. And they said, Angel Flight, we want you to do this more and to do it better. So we take that partnership very seriously, and we're honored by it. You know, we say all the time now that these are very turbulent times, and there's nobody better at navigating turbulence than pilots. And so we're excited to climb above the turbulence and find that really smooth air and tailwinds to get us back moving people where they need to go. And so we're really excited about that. We're, as I said, we're outcome-driven organization. We measure everything by data and metrics, but without losing that one patient at a time and one person at a time and that personal touch. So we're not going to compromise on any of those things. We have put together goals here. Like I said, we were throwing a big wrench in our initial ascent to 8,000, but we're excited with these funds and to continue that agile method of management that we talked about. That's being led by one of our team members, Stefan, but the entire team is involved, and I'll get into some of those initial plans here shortly. But we're about increased efficiency growing into that need. We want effective utilization of resources. So this is not a one-to-one situation, like we're going to double our budget so we can double our services. We want this to be a true platform approach to help us scale to meet this need. And we also want it to be audacious. We want big vision. We want this to be national leaning. The uniqueness of transportation and healthcare is not specific to California or the 13 Western states. It's everywhere. And we have the opportunities to be the leader and bring those along with us there. So we're going to do that. And that audacious goal sounds crazy, but to serve 10% of that total need, that's a big number. But guess what? If we serve 10%, then hopefully we can serve 20% and so on. And that's really the map that we're trying to draw. And then in terms of what that looks like, we have different verticals within our organization, just like other groups and other companies. I'm sure your company has some of these too. So we really lean into technology to do a lot of the work for us. So we continue to want to use VPOIDs in our app as a self-service type of platform that allows our patients, our social workers, our patient navigators, our pilots, our drivers to be able to use that easily to find the matches and the resources that they want to donate with the need that's out there. We want to connect, just like we're trying to right now, connect our volunteer pilots and our Earth Angels together in a community where those things are easier to discuss. Many of you are in type groups and that types of things with your plane, and you've seen how that works and how that benefits and gets people bought into a shared vision and goal and motivates people. So that is on our roadmap as well. Effective use of airplanes, that means commercial airplanes and GA airplanes. I know many of you have called me when I was either coordinator or now that I'm executive director and said, hey, why are we flying one person across the country in 4 different planes? That's a terrible use of resources when I can buy them a Southwest ticket for a couple $100. Yes, we hear that. We want to, as we scale, we have to use our resources most efficiently. And that doesn't necessarily mean dollar-wise, but where there's resources that want to be donated, where there's resources that we can supplement, where there's other nonprofits that can help, et cetera. So that is a puzzle that's put together every day by our coordinators, but we can help them do that more efficiently using technology. And that's what some of these things are. You'll see a new website launched here shortly this year. Again, easier use, better acquisition of volunteers, patients. We know you guys use and rely on our website frequently, so do our patients and healthcare providers. So we want to make sure that it's doing as much heavy lifting for us as possible. Outreach obviously has been a big focus where it hadn't really been prior to 2014, but moving forward, that continues to be a big thing. Believe it or not, a free service is hard to give away. Not a lot of people know about it. A lot of people think it's too good to be true. And we fit in this very unique niche within this transportation to healthcare that a lot of people don't think about, right? If you're from rural Idaho, your first thought of how to get somewhere is not, in a Cessna 182. Like, it's just out of their realm of comprehension. And so that education piece and reaching those communities, those patient communities, those healthcare communities, individual patients themselves is really important, and it's really hard. We just have one person there right now, so that's on there is to add regional outreach associates in different regions to help us with that. Our wing leaders and wing leadership teams have been phenomenal at that. We want to set them up for more success, give them more time and resources to do that. We know we need to get better at pilot recognition and retention. We've got some technology tools here in terms of using Salesforce integration with our existing system to help us better set up regular drip campaigns and other campaigns to reach the people that we need. And communications and marketing is a big part of that too. So there's a position there that we've been waiting for a while to activate that we feel can markedly change some of those metrics that we talked about in terms of new requesters, new partnerships, et cetera. Our program operations, this is what most of our volunteers are most familiar with. We mentioned that No Patient Left Behind Fund. We're able to activate a lot of those funds toward that. So what that looks like is backing up some of your flights with commercial airline tickets. So our pilots don't have to, worry about that go, no-go decision if weather gets bad or, if a mechanical issue pops up. We know our Earth Angels have been underappreciated and underutilized. So we plan to staff someone specifically devoted both to arranging Earth Angel trips, but also recruiting new Earth Angels and onboarding them. Our orientation needs an overhaul, as do our other training modules. So that is tasked with too. It's that has been a long time need in the making. And as we grow in missions, we'll add mission coordinators too to help with the service of those patients and volunteers needed, as well as there's a couple other sessions this week already on efficient routing and planning technology, and some technology being created by Carnegie Mellon and UC Davis and a few other groups. The implementation of those donations of technology are part of that plan as well. And then safety will continue to be an investment. We're planning to create more training modules in partnership with AOPA, ASI, and NTSB. We'd like to develop more additional safety notifications into our technology and our platform. I mentioned those funds earlier, that it's going to be a big safety component for us. Again, getting out of that mission mindset and making sure that safety is a priority. And then as part of those website and community portal, that safety presence will be a big focus there too. So our volunteers can exchange best practices. Our wing safety officers can be a resource for folks. Our Angel Flight Safety Officer, Rich, can be a better resource to folks and have more presence there. And then organizationally, I talked about this a little bit. We've got an amazing team. I want to make sure they've got the development, training, and retention so that we can keep this great team as we add to it that can sustain and navigate through this kind of aggressive growth. We want to maintain that active leadership within the public benefit flying community to bring others along with us and make sure we're using all those different pieces the best way we can to achieve the end goal, which is getting those people where they need to go. And we want to continue to invest in being sustainable and not, at the end of 2 years have to rubber band back because we don't have any funds. So we're going to make those investments into some of these programs that we're doing, and that leads me perfect segue into our development. Again, we've got some outdated software and strategy there that we're going to update. A development assistant is needed for Mary and her team. We plan on putting much more emphasis on planned giving. Actually, one of the things that was able to help sustain us now were a few planned gifts that people gave bequests to us as they moved on, wanting to continue that Angel Flight legacy even through their death. And then some prospecting data subscriptions, et cetera. So this is an initial roadmap. Obviously, this is not exhaustive. And what we've done as an executive team is gone through and prioritized these. And we'll be doing these in succession. We try to do them in quick 3 to 6 week projects to measure them and then implement them. And so that's what will be going on. So you'll be seeing lots of changes. You'll probably be getting lots of surveys and different things for us to help through that. And throughout the week, we'll be asking for feedback on the different sessions to help with some of these growth initiatives. So I'll just stop there for now. But I'll also say, anytime, those of you who've called Angel Flight, you always get someone that's going to pick up the phone. We welcome those phone calls, those emails. We want you to follow on all the social. We want to hear from everyone. We want to stay connected. Our volunteers are truly the face of our organization. Thankfully, that doesn't have to be my ugly mug. So we want to hear from you. We want to see you, and we want to learn from you. And that's what this weekend is really about. We've got great plans, but the strength of our organization will always be our volunteers, and the inspiration will always be the patients that we're helping. So that is where we've been, where we are, and where we're going. We've got a whole schedule coming up, and thank you. I see all these participants that stuck around through this whole thing. I'm going to open up Q&A now. And by the way, this doesn't just need to be for me. I've got our whole team on here. Sherry's here, Stefan's here, Ivan's here, Mary's here. Rich Connie, our chairman of the board, is here. So we welcome questions to anyone, either what you've heard or maybe something you didn't hear that you wanted to hear. We've got some time. We'll take at least 15 to 20 minutes to answer those questions. I know some of you probably wanted just to see the presentation and then jump. So we thank you for coming. And again, I would encourage anyone to sign up for those other sessions. We have another closing session on Friday that we would encourage you to attend, where we're kind of going to distill a lot of the lessons learned of the week. We also are going to do some volunteer recognition for outstanding volunteers at that time as well. We have an actual board meeting, which usually starts our annual retreat, that anyone is always welcome to any board meeting at Angel Flight to see how the governance works. And we get more into numbers and budget and, legal concerns, all the different committees that we have. And in fact, we have got one on board management specifically about, what's involved in becoming a board member, which I know many of you have signed up for, that our board management chair, Trevor, is going to lead. So I'd encourage you to sign up for all of it. I'll be in all of them. So you can, make fun of me or whatever to pass the time and entertain. I'm sure the rest of the staff will do that. So I'll just go ahead and jump into questions. But before I do so, did I miss anything, Stefan or team, that we need to cover or you want to mention before we get into questions?
Well, Josh, I think you've got Rich on line now if you want to call on him.
Rich, are you
Yeah,
unmuted?
Josh, can you hear me?
Yes. Floor is yours.
Wonderful. I have to thank Stefan for staying with us. It was quite a series of checking off options one by one, and we finally found the way in. So kudos for persistence. And if I could just take a minute or two to address the staff and the group, I'd love to do that. I won't take up too much time. So just for those of you on the phone, my name is Rich Conti. I'm not on the screen right now because I've got some internet problems that prevented me from getting on at all, but now at least you've got my voice. I would say that I'm honored to be in my third year of serving as the chairman of the board of Angel Flight's board of directors. And as Josh had mentioned earlier, the board of directors is really a governance body that helps Angel Flight with fiduciary matters of policy, organizational capabilities, and probably most importantly, fundraising. And it's a terrific group. As Josh mentioned, we're going to have, as the lunch and learn session on Friday, a program that's entitled Joining the Board. And that'll address more about what the board does, why we're here, what we look for in membership. And so if you have an interest in that, please do sign up. We'd be happy to have as many people as we can. Trevor Moody, who's our board committee chairman, will be handling that along with me, and we'd look forward to seeing you all. So I had asked Josh just to say a couple of words to open this, but I'll kind of close Josh's session. He's done a terrific job of giving you the where we've been, where are we, and where are we going. This pandemic has thrown all of us a tremendous number of curveballs. We've been challenged by a lot of things in terms of what we do, how we do them. And in fact, this meeting, as Josh also mentioned, our annual strategy retreat, it's always been one of the things that we value most in terms of pulling the organization together face to face, exchanging ideas, building connections, building camaraderie. I think Josh used the term rubber chicken. Usually we actually do maybe one notch better than rubber chicken, but it's always great to have people together. And this year, of course, that's obviously challenged. But Josh and his team, I think, have done an outstanding job of creating a program that will serve almost all of those objectives, but in a virtual context. So kudos to the group, because that is a very heavy lift. I think it's hard to overstate the amount of work and commitment that's required to pull this kind of thing off. But I think as the week goes on, if you join some of the sessions during the week, you'll see that the team has pulled together an incredible week. I'm convinced actually that we're going to all look back on this someday and say, wow, that was one of the best retreats we've ever had, because the staff has done, along with Josh, a tremendous job of pulling things together. Another word of thanks that I wanted to provide was just to all of our volunteers, all of you in every capacity, whether it's pilots or Earth Angels, those who help out with fundraising, administration, outreach, whatever it might be. I just want to say thank you very, very much, because all of the stories that Josh shared, all of the different ways that we deliver our mission, it's really you guys that make this organization able to have the capability to fulfill that mission. And so I just want to say thank you from the bottom of my heart, as Josh has done as well. And finally, I just wanted to talk briefly about the state of the organization. Now, Josh has, as I said, given you the where were we, where are we now, and where are we going. And so I'm not going into any detail here. I just wanted to acknowledge that we've been challenged by a lot of stuff during the pandemic. And, you know, Angel Flight probably encountered more than its share of challenges as we made our way through 2020. But the key message I wanted to deliver is just one of assurance, and that is that this organization is very, very strong. We continue to attract, you know, really strong volunteer group, people like you, people who are passionate about what we do as a mission. We continue to attract funding from people, foundations, organizations who are committed to helping us do that. So, you know, those are the two big pillars, if you will, you know, aside from the people who need our services. But as Josh mentioned, we're reaching only a very small portion of those. So we've got a lot of headspace there, but it's the volunteers and the ability to fund that really allow us to do what we do. And we are quite healthy in that regard. And as we approach 2021, we do it with a very sound financial base and a very sound group of volunteers that are helping us, you know, push forward with the mission. So the future outlook of the organization is terrific. Our ability to deliver what we call hope and help is very exciting as we look forward to 2021. And I wanted you to hear that from the chairman of the board, so to speak. I don't throw that title around very often, but in this case, I will say you're hearing it from the chairman. So thanks for all that you do. Welcome to our 2021 planning retreat virtual, and be sure to take a good look at the schedule. And we hope to see you at many of the planned sessions during the week. So Josh, thanks, and I'll let you get on to the Q&A.
Yeah, you bet. Thanks, Rich. You said everything much more succinctly than me. Maybe you should present the State of the Union next time.
Couldn't have done it as well as you. I feel what you feel, but I don't show as much emotion, but I think it's helpful to see the emotion, because it really brings home the depth of the importance of what we do.
Thanks, Rich. Yeah, and thanks to our entire board. As I mentioned earlier, just having the volunteer group that we did to help us navigate through this, and that leadership they exemplified, we're really fortunate. Okay, Sherry or Mary, actually, first of all, I'd be remiss if I didn't thank Henny. Henny Alamillo is one of our development associates, and she is the one that set up all these Zoom meetings and has trained Stefan, John, and I to be less adequate Zoom moderators than her. It's a lot. And it's we've gone back and forth a number of times on how we do this and how we host it, and our guest volunteer presenters, and you've seen some of the growing pains here in our technology hiccups. So we appreciate it. And Henny, I just want to thank you very much for all the hard work you've done, and the entire staff. It's a lot to pull this off in an in-person, and virtual is, I would say, at least 2 to 3x. So I just want to thank everyone there. With that said, can someone drop in the link, if we haven't already done it, drop in the link for the schedule that has all the different schedules and the Zoom links and so forth in the chat, so folks can add those to their calendars where they see fit. I'll jump into some questions here. Welcome some more. I see some coming through the chat. It looks like most of those are being answered by the staff. However, staff, if you want me to answer one of those, just chime in here too. I'll go to Neville. Thanks for your question again. He says, recognizing the importance of passenger privacy, is there a way volunteers can be kept apprised of how passengers we've flown, driven are doing? Great question. Often, if there is major news, even bad news, Sherry and the missions team will send out a message to every volunteer that has interfaced with that passenger and let them know. We also have the ability in Missions Available, if you've flown a passenger you like, that you can favorite them. And that's another way that you can see where they're going. In terms of privacy and news, it's a tightrope we walk. We would only do that with the passengers' permission. So that's why Sherry and the missions team is usually the one that is notifying those out, because we do respect passenger privacy. And for those HIPAA questions that are probably incoming, because they're volunteering that information to us for when we schedule these, we are HIPAA compliant in that regard. But some passengers are wanting to share more than others, and in some cases we need to keep things confidential, and so we don't list every little detail in the mission description. So but we appreciate that, Neville, and like that favorite thing, like I told you, will help you see if that passenger comes up again. And if you have a question on specifically how to do that, the missions team can help you. Jim Lewis, wow, this is great. Jim is offering his expertise and career experience helping with our fund development committee. So Jim, I'm gonna tag this one for Mary. Jim Lewis, Mary, one of our volunteers, is offering to help us to be an advisor in that capacity. Jim Hesseman. Jim is a new volunteer pilot and the president of Air Care Alliance. And he's asking, the Air Care Alliance has a referral system. For those of you who don't know the Air Care Alliance, it's like a trades group of the volunteer pilot groups. So all the Angel flights are part of that, Corporate Angel Network, Pilots and Paws, Veterans Airlift Command, Lighthawk, all the different groups are part of that. He's the president. They have a referral system. Again, we're trying to leverage that outreach piece that I mentioned. So this is a national leaning outreach tool that people can go to. It does get pretty good organic search results. And what folks do is fill out information and then it refers them to the appropriate site. Stefan, who's our CTO, helped create that. So we're excited that's going to benefit us. We get several referrals from there each week. And this is built a little bit more robustly and should have a little bit further reach because of the success that it has. So we're excited that may help us find more people in need of our flights. Thanks for the question, Jim. Mike is asking, in regards to the mission itinerary, I see a link, view print the mission itinerary form for this missing leg. I can view it, but I don't see a way to easily print it. What am I missing? Mike, I would encourage you to email missions team, but it's most likely with your browser. If you can view it, usually Control-P on your keyboard will print it. If you can't find the print function in your menu, usually Control-P will handle that. But if you're having trouble and don't mind doing some screenshots, the missions team can help you solve that one. Dr. Hunter Hansfield, hope you heard your shout out earlier. Thank you again, Dr. Hansfield's been a longtime volunteer for Angel Flight, past board member, and a virologist who Sherry and I called panic at the beginning of the pandemic saying, what is this going to do? Little did we know totally what it would do, but Dr. Hansfield was there the whole time and navigated us through it correctly. He is asking about the Bloodworks Northwest flights and kind of giving some more information. Overall blood demand is lower than historically. Again, that's part of the healthcare system, not serving as many people right now because it's reduced surgeries and the social distancing and et cetera has made the blood collection process, especially by volunteers, difficult. Kyle is our main contact there at Bloodworks Northwest, and we're in regular communication with him. And I know they're eager to get going again too. So hopefully in the not too near distant future, those will come back online. Dennis Malloy says, I am always impressed with the professional, upbeat, and calming nature of all my communication with the operations team. I can imagine you deal with cancellations, conflicts, and for lack of a better term, crises often. How do you deal with them? And do you have any suggestions to us pilots and Earth Angels on how to make your work easier? Wow, Dennis, what a great question. I'm going to let Sherry answer that question because you're right. They are amazing. And believe me, it's not always the kindest person on the other end that they're dealing with. So I appreciate that compliment, Dennis, and your willingness to try to make life easier. Sherry, do you want to have any suggestions for volunteers on how to make your work easier?
Yeah, well, Dennis, I echo Josh and thank you so much for your comments and your questions. And you're right, there are days, as a matter of fact, if you join any of the operations meetings over the next couple of days, I think the staff will tell you today was one of those days. Our team was juggling a lot of balls today. And really, as far as the volunteers making it easier on the staff, I think the simple answer is just communication. Good, easy communication, clear communication, keeping in touch with your passengers, keeping in touch with connecting pilots, and communicating anything that you're unsure of with the mission operations staff. And while the extra communications is also extra work, it really does help calm nerves for people in many of the situations. So thank you so much for your kind words. I guarantee you 100% that the mission operations team who is listening in right now has got some smiles on their faces. So thank you for that.
Thanks, Sherry. This is an anonymous question, but someone flying an experimental, so he knows no passenger flights. He asks, am I correct scanning the email mission list for 0 passenger listings? I've never seen one, unfortunately, but might not know how the equipment organ transport flights are listed. Stefan or someone from the missions team, do you want to take that one? Or answer it offline?
I'll just say that's a great idea for a new feature. I love it. I've already written it down.
There you go. All right. Did I miss anything in chat team? This is actually coming out quite perfect to 5:30, if not. Thanks, Jim. Miss seeing you. Jim Hudson, one of our former Idaho wing leader, longtime volunteer. Thanks for joining us.
Josh, a couple questions about flying supplies. Do we have any more supply flights coming up, or what are the prospects for that?
Yeah, again, we continue to reach out to those nonprofit partners. Most of that kind of urgent need for PPE was resolved because they could get up, they could get both the production and the distribution channels up. So we're not hearing a lot of that. Even Project Cure that I referenced earlier, the last communication I had with them is a lot of their stuff now is just regular, like they know when they need it and who needs it and what time, because they're out in front of that demand cycle because it's been out there for a while. In terms of vaccinations, that's a little, vaccination materials and teams, that's a little bit still in flux. Again, on both of these, we by no means are the experts. We're knocking on doors and making phone calls and doing all the rest too. So if you have relationships with other nonprofits, healthcare facilities, producers of these things, pharmaceutical companies, you name it, we'd welcome those introductions, and we can, bring our service offering and our value add to that situation. Again, we're not trying to disrupt any existing things if it's working, but we want to be there when needed. So that's kind of how that is working currently. Ivan is in touch with our wing leaders regularly on that. I reach out to my nonprofit communities, and the Air Care Alliance that I mentioned earlier has been really active on that. That's how we got pulled into this thing that I mentioned earlier with FEMA and Project Rubicon. So those relationships are, what helps us navigate through these. So if you know of those opportunities, we've got several thousand volunteers that are looking for those. So we're happy to leverage that resource to achieve those ends. Oh, Scott, thanks for that encouragement. We echo right back to you. We are always impressed with our volunteers and interaction with you. It's inspiring to know that people take very, very much time and energy out of their busy days to help us accomplish this mission. And thank you, John Mahaney, another longtime volunteer. Great to see you in here. All right. Well, again, thank you for your time. We'll wrap up here. One more time, we'll put that link in for our schedule of events. And excited to see you on the rest of the sessions. Thanks again for the team for your hard work to put this together and for bearing with us as we do this virtually. So excited to see so many folks in here and to see you virtually. Recognize a lot of these names. Some I don't know, so I look forward to getting to know you both virtually and in person. Like I said, don't be a stranger. Call us, email us anytime. That is what we're here for. And look forward to a really great session and a really much better year than 2020. Let's say cheers to 2021. This officially starts the happy hour part of the conference. Again, wish I was clinking glasses with all of you, but excited to do that even bigger and better, hopefully next year. So thanks so much again. This recording will be made available. I saw one question about slides. We can make those available too. And again, thank you all and have a great night and a great week.